Welcome to today's community conversations. My name is Nicole Rochester. I am a new member of the Health Advocate X board, and I am so excited to have this conversation today with Melinda Stewart. I'm not going to read her full bio, but Melinda Stewart, PhD, BCPA, is a board certified patient advocate. She is the CEO of Compassionate Navigation LLC, a master in communication. I have firsthand experience in this and an ally. And you all know it's June, it's Pride Month, and what better time to have a conversation that talks about what we're going to talk about today. So, the topic for today is addressing harm for LGBTQIA individuals, how to be an advocate for health despite challenges. So, Melinda, I'm so excited to have this conversation with you today. We all know, not, we acknowledge it during Pride Month, but of course, we know 365 days a year, the LGBTQIA plus community faces discrimination and literal attacks on their ability to live peacefully and happily. And the current climate, I must say, is particularly volatile. So, to get us started, can you share the key things that we need to know about the challenges that this community is facing currently?
Absolutely, Nicole. Thank you for the introduction and welcome everybody. I want to give you just a little bit of information about why I am speaking on this topic. This is, something that is very, very near and dear to me. This is a community that I am aligned with. So this isn't just me talking about a community, but this is the community that I myself am a part of. And this is something that is the group that I mostly do when I do patient advocacy work. These are the patients that I am working with day in and day out with my advocacy side of things. And the other side of the work that I do is in conflict negotiation and helping people work through conflict. So I've been a very busy individual these last couple months because really, I mean, we can look at this on so many levels. But to start, let's look at this from a legislative standpoint. And we have currently over 500 anti-LGBTQIA plus bills that are being introduced this year. And many of them are targeting trans youth and really focusing on getting access or denying access to gender affirming care. So, on a big level, legally level, right, we are seeing all of these attacks against allowing people to be who they are. Societally, this is then fueling the fires that we're seeing all the time. We have increased harassment, bullying, public discourse continues to frame the LGBTQIA population as dangerous, as inappropriate, even challenging who and where they should be going to the bathroom because they're dangerous. And we know that when you actually start to do any type of research on actual accounts, the information is just not there. The data doesn't support what is being presented in the narrative across society. As a result of these two things, we see safe and affirming care being limited. It was already limited, but especially given the current political administration, so many, even more facilities are reducing, if not completely eliminating, these services that they have for a diverse population, such as LGBTQIA population. But what's really important with this, additionally, is that this is already, as I mentioned, already affecting under-resourced areas, but this is compounding discrimination because a lot of this isn't just the LGBTQIA populations, but we have multiple marginalized individuals within BIPOC, disabled, neurodivergent that are also LGBTQIA. So it's not like these attacks are just going after one population, but a whole wider population within it because it intersects so much. So it's not just a political issue. This is really becoming and has been a public health emergency for quite a while.
I appreciate you ending with that, the public health emergency, because many of us here are healthcare professionals, healthcare advocates, and also members of the public. And this directly impacts us. Whether you are a part of this community or not, is something that we all should be concerned about, particularly if those of us who are in the healthcare field. before I move on, I want to say that we want this conversation to be interactive. So I neglected to mention, please feel free to put any questions that you have in the chat. Also, if you have comments, light up the chat. We want it to be interactive, and I will be looking at the chat and making sure that I lift up those questions to Melinda. So you don't have to wait until the end. Feel free to react throughout the program. So, Melinda, as you start talked about this idea of this being a public health emergency, can you speak to the impact of on health outcomes specifically in the LGBTQIA plus community?
Yeah, absolutely. So it's been long standing that there's a huge mistrust with healthcare providers. And based on, we've talked in previous community conversations about medical gaslighting, and there's a lot of medical trauma and neglect that has been happening within this population for decades. Um, and these negative experiences are going to reduce the trust in actually seeking out care to begin with. And when they do go, there's a lot of hesitation. There's going to be reduced adherence to what is being said because of that mistrust. They might not follow up. If they do go and they have a bad experience, the likelihood of going back to that provider is reduced dramatically. And again, that's if they can even get access, right? LGBTQIA are often denied health insurance. They have issues with, placement of finding doctors, getting, like I said, getting that insurance, being able to pay for this because of work limitations and whatnot. Um, but when they can get care, we have mistrust first and foremost. The care is then delayed because I might wait a really long time until it gets to that point. One of the patients that I first started working with, a trans individual, and they had what sounded like to me, and I'm not a medical doctor, but it sounded very much like to me that they had a pretty severe UTI. And they were talking about having symptoms for 4 to 6 months. And I'm like, we need to get you to a provider ASAP. Like, this seems very, very clear to be a UTI. Here are the dangers of waiting this long. So we went together. I was able to advocate for them. We got them the care. I was correct. And we got them the care that they needed. But had they not shared this concern with me, I would have never known. And they weren't even a client at the time. They quickly became an actual patient of mine after that. But it was just kind of a friend sharing with me, like, man, I've got this really uncomfortable experience. I'm like, do, do you need to go to a doctor? Like, we need to have this conversation. Like, I don't trust. And we talked about that. So they were delaying this care because they were fearing the discrimination. And so they just avoided it and postponed. That postponement, that avoidance is because we're experiencing chronic stress. Is it going to be safe? Are we going to be dead named? Are we going to be denied care? Are we going to be asked really inappropriate questions, especially my trans patients? The the number of questions that they are asked that just blow my mind that anybody would ever ask just really weighs super, super heavy on these individuals. And as a result, we see higher rates of depression and anxiety, PTSD. Just looking at this year, I was looking at some of the statistics the other day, and they're saying 1 in 10 young LGBTQIA have already attempted suicide since January of 2025. And 46% of all members of all ages have had at least one suicidal ideation. So this is this is having a huge impact. So it's not just hurting feelings. This discrimination is drastically changing health trajectories, and it it's just getting worse right now.
Yeah, it's not just hurting feelings. I felt that. That's very powerful. And I appreciate you highlighting it's not just hurt feelings. Like there are negative outcomes as a result of this. And as I was listening to you talk about this idea of mistrust and delayed care, this is what we see in a lot of marginalized communities. Like there's so many similarities, which is why I also appreciate you talking about that intersectionality.
Mhm.
But when you have a community, whether it be by race or gender identity, sexual orientation, language that is marginalized, and then we blame them for their own poor outcomes, but we are the ones that are contributing to those poor outcomes by creating these unsafe conditions. And any of us, I mean, if you are not being treated properly, then you're going to avoid that situation. And so when we have these unsafe conditions in healthcare settings, we shouldn't be surprised that
Right.
members of this community are choosing not to seek care. You use the phrase, and I don't want to assume that any of us on the line are well versed. So you use a phrase dead named. Can you just explain for the audience what dead named means?
Absolutely. So dead naming is when an individual is typically trans. Uh, they are given a name. We are all given a name by our family. And oftentimes that name is pretty gender based. So when an individual is go through social transition and saying, this is who I am, they're making peace with who they are and they're putting a name to their identity that matches their gender identity that they feel inside. That name that they chose is often different that's on the legal records or the official name. There's a lot of ways that people call it. And so even if I have legally changed my name, there is still often in the medical records the previous name. And so if you are dead naming someone, you are using that other name, even though I've given you the name that I want to use, that is the name that I go by. If you're using that previous name, even if it's in the records, that's considered dead naming. And that can be really, really harmful because that's that person's identity. And by you denying to use that name, you're denying that identity. So even you always want to make sure that if you're looking in someone's record, that if there is a box that says preferred name, or that's the name that they give you, that that's the name that you're using, even if it doesn't match. And if they give you a different name, let's say that in the box it says Christopher and you come in, I'm like, hi, I'm Dr. Melinda Stewart. I'm going to be working with you today. My pronouns are she, her. Can you tell me your information? And you present to me, you're like, hi, I'm Nicole. My pronouns are she, her. And I see that that doesn't match. It's my job to make sure that I just take a note. Thank you, Nicole. I really appreciate that. And that's the name that I use. It doesn't have to be a big deal, but it means so much to my trans patients when someone just acknowledges the name that they were given and doesn't insist on, well, it just says on my chart right here. I have to use this. No, you don't. No, you don't. You can have it for the insurance purposes, but you as a human being can use the name and respect their pronouns because you respect that person as a human. Point blank, period.
Thank you. Thank you for explaining that, Melinda. I
Yeah.
can say, as a physician, although I'm not practicing currently, I'm still intricately involved in a lot of the clinical work. And I do know for sure that in most states, if not all states, there are requirements for collection of SOGI or sexual orientation, gender identity data, as well as race, ethnicity, and language. And
Mhm.
so I'm seeing, and hopefully this won't be scaled back, but I'm seeing where it's literally being um, formalized, in terms of there are programs or not programs, but there are methods for and policies and procedures
Yeah.
for collecting this information and having that space in the medical record for preferred name, having a space for preferred pronouns so that we can communicate effectively and sensitively with our patients. Well, as you talked about trauma and medical trauma, it's hard for me, frankly, as a physician to reconcile that there is a lot of trauma that we are like that healthcare professionals cause, but I know that that is true.
Mhm.
So, can you talk a little bit about how healthcare professionals themselves are a big source of harm to the LGBTQIA plus community? And I know that you have this term you talk about everyday harm. And so I'd love for you to share how everyday harm
Mhm.
is perpetuated in medical settings.
Yeah. So everyday harm are the little things that most people take for granted. Like it's those things that when someone pushes back, you're like, well, I didn't mean that. I didn't intend for that. Well, okay, great. You weren't being a jerk on purpose, but you still hurt someone. And I use this example with my students all the time. It's like if I'm walking down the aisle and I accidentally backhand, I talk with my hands a lot. And if I accidentally backhand you, right, I still hurt you. I still physically hurt you. I didn't intend to hurt you, but that intention isn't what matters. The matters the impact that it had. So I could have a completely unintentional, completely innocent slip of the tongue and hurt someone in an everyday interaction. And but that's still harm. And when it might be one little paper cut. Oftentimes we can equate these to microaggressions, right? They're little things. It's not a big deal, but one paper cut hurts. 10 paper cuts really hurts. Getting a paper cut, if you knew that you were going to get a paper cut every single day, that's really gonna add up. And a death by 100 paper cuts or 1,000 paper cuts is a real thing. So everyday harm can be microaggressions. For this population, this can be misgendering. This could be that invasive curiosity, asking questions that you really don't need to know anything about. Heteronormative assumptions. So when I'm in with that provider and I'm asked if there's any risk that I could be pregnant and I am presenting, they're seeing on my chart that it says that I'm female, but I'm presenting as male, you're assuming, you're making some assumptions there. Or if you're needing to ask about sexual behavior, then you're automatically jumping to the assumption that I am with a a cis male. And so are there assumptions that are just being made? That's that implicit bias that we talk about all the time, that there are little things that just come out of our mouths without really thinking about them. And like I said, we're gonna make mistakes. Like it's okay to make a mistake. It's okay to have something that you didn't intend to hurt someone. But when you do and they push back and you find out that that in fact did hurt them, it's our job to do better and to be like, oh my gosh, I am so sorry. I did not mean that. Thank you for letting me know. And then you just go and you do better. You don't need to keep pushing and apologizing. Apologize, own it, promise to do better, and then, do better. Everyday harm can also include like forms in the intake process. So if we aren't using inclusive language on the forms in the clinics that we're working in, or not offering options for gender or sexual orientation, gender is not just male, female. There's male, there's female, there's intersex, there's non-binary, there's transgender. So we need to have options for that. Sexual orientations are expansive. So you're not going to, and it's not expected that you're going to have every single possible option. I think the last I checked, there was like 27 different categories for sexual orientation. I
Wow.
had no idea. I'm like, are you serious? So you can put the basic categories, have an other option, and then when we put that down, the best thing that we can do is so tell me about that. What does that look like for you? What does that mean for your health? But we only want to ask questions for care, not for curiosity. Like, what questions do I need to ask you for the care that I need to give you? If you are coming in for asthma, I don't need to know who you're having sex with. Doesn't matter to me. And that's a big piece with some of this is what information do I need to know to give you the care? Other than that, it doesn't, you are just a human being who's in my care and needing my help. So I'm gonna be protective of not dismissing the individual because that, ignoring lived experiences, failing to considering relevant identity factors for towards that treatment. But if I'm only focusing on the fact that that person dresses different, looks queer, looks a certain way, that's impeding my ability to give the care that they need. So I need to make sure that I'm focusing in on what actually needs to get done and not all of these other things, because that can be really harmful.
Thank you for sharing that. You always say, you always phrase things in a way that just makes me like take a pause and want to take more notes. So this idea of invasive curiosity, I mean, that really resonates. And I hope that it resonates with the audience as well. And this idea of, it's kind of a need to know basis, like like you said, if you're coming for asthma, some of that other information is really not relevant. And I've seen that play out in healthcare settings. And sometimes it's innocent where individuals really are genuinely trying to get a better understanding. But to your point, our intention and impact are two different things. So I also love the example you gave of that. It doesn't really matter at the end of the day whether we meant to harm, but if there is harm, then acknowledging that. On that note, I want to acknowledge a comment because
Yeah.
I may have inadvertently caused harm. And there's a comment in the chat about moving away from saying preferred pronouns
Yes.
and just saying pronouns because they are not a preference. They just are someone's pronouns. So I appreciate that. I love being called in and I do want to apologize and I will make sure that I correct for the rest of this talk and in general to say pronouns. That's something that
Thank you.
yes, and thank you for the person who commented. Also,
Yeah.
there's a comment about microaggressions,
Hmm.
which is another that everyday harm, definitely what you were describing or what many of us would call microaggressions as
Hmm.
well. So what can we do? We've spent some time talking about the many challenges that this community faces, the discrimination and the gaslighting and the dismissal and the erasure and all of the things. Those of us that are here, I'm sure we're wanting to start to understand how we can make a difference in this space. So what can healthcare professionals and what can professional healthcare advocates do to mitigate this harm that you've been describing?
Yeah. And I think all of these pieces, everyone can do, right? These are not just limited to, professionals and providers, but everything within compassion and navigation comes down to three core values: courage, curiosity, and compassion. So we have to have the courage to have the difficult conversations that, make us uncomfortable so that we can learn and do better. We need to ask questions. We're not going to be judgy. We're just going to try and get as much information that we need, depending on what we actually need. And then we're going to have compassion for everybody. As I said, I typically work with neurodiverse and LGBTQIA patients in my advocacy sides of things. But I'll work with anybody. Right now, if you are specifically needing something in cancer, that's not where my expertise lies. So in those cases, I am going to pass that to someone who can do that because they have that knowledge. But I've heard of people refusing to work with LGBTQIA patients just because of, well, I don't understand what it means to be gay. But you don't need to be. You don't need to be an expert in every single culture that you're working with. You just have to recognize that there may be things about that culture that have an impact on our health. So that's the thing, just having cultural humility, listening before you speak. So I always say that we were given two ears and one mouth for a reason. We should be listening. We should be asking questions and truly listening to what individuals are saying, believing what they say, and then getting the help what we need. Regardless of the population that you're working on, we need to reflect on our own biases and work to unlearn things. We've been taught all sorts of things about all sorts of people that are inaccurate. And our one of the things that I want to say about this is it's natural that everyone has biases. Like every single person has a bias in some way or shape or form. We love to categorize, we love to label. That's just what our bodies and our brains naturally do. So don't worry about, oh my gosh, I'm stereotyping someone. Yeah, you are. Okay, cool. What are you going to do about it? You recognize that this is coming up. So we take a minute, we check that, and then we move forward. If we need more information, we have the courage to ask that question. We give that compassion. In professional settings, what can we do? Well, we want to make sure that we're creating affirming systems. So the forms, the signage, training individuals on how to have these conversations. How do you ask a patient what their pronouns are, what their name is? If you're looking at a sheet and it says male, it says Christopher, it says all of these things, and the person who just walked in the room is in a beautiful pink dress and their makeup is better than yours, because that's typically what happens, and it just makes me, I'm like, your paint is perfect. Do mine. And, you know, how do I ask those questions? Right. And that makes people really feel uncomfortable. And so a lot of the training that I do with hospitals is how do we ask those questions that might make us feel uncomfortable? And it's way simpler than you ever think that it could be. It's way, way simpler. And it can be as simple as giving my name, giving my pronouns, which then tells them that I understand that pronouns are important and I'm opening that door, and then giving them that opportunity to give that information. But I have to be trained to know how to navigate that process. And as the individual mentioned, if you can avoid saying preferred, I know in a lot of the medical systems they have not picked up on that issue. People saying it have gotten better, but I know in the systems it is what it is. So it might still say preferred, even though all of us are like, it's not preferred. It's just my identity. That's my pronoun. It's not preferred. But what can we do within this system? Can we have gender neutral bathrooms? Can we make sure that the signage is inclusive? And when mistakes happen, because they're going to, know how to apologize, know how to navigate. We want to avoid making mistakes as possible, but we're humans. And as long as you are authentic and you're like, you know what? Oh my gosh, I'm so sorry. I said preferred pronoun. I recognize that it is a pronoun like you did. We just move on and we do better. So just taking responsibility, and when, like I said, listening to when people come to you and say, hey, this is a problem. This individual, I gave my name at the desk, and when they called me to come back, this is a continued issue that I have with a lot of my patients. They will give a name, and when the person comes back, they just look at the name on the chart and they still say Christopher, even though I've given the name. And so they've just been dead named in front of everybody. And, if I am Nicole in my beautiful pink dress and I'm getting called back as Christopher, I have to stand up in my beautiful dress and walk back there and watch everyone in that waiting room looking at me like, what what's going on here? And that's, I think, what people don't understand, especially when they're dead naming, is who is that individual walking back and what is the environment that they've just created for that person, whether they want to, you know, have a conversation about it or not. But that's a very private thing, and I shouldn't have to be stared at and gawked at when I'm being called back to go see the doctor. So those
Man,
are some things.
those are a lot of things. Those are great. It just, what you're sharing, Melinda, is that it's an individual thing. Like there are things that we can and should be doing as individuals. But then there's these systematic things. There's policies and there's practices and signage and training. And these things require resources and investments and it's necessary. This should not could be considered something that's optional, but it's so much bigger
Mhm.
than the individual. And at the same time, we as individuals, there are things as you outlined that we can be doing.
Mhm.
What about, how do you, I've seen, my daughter is a member of this community. I should have mentioned that earlier. I'm a proud mom. I should have worn my proud mom t-shirt. I love my
Yeah.
proud mom t-shirt. But she has shared with me a lot of the challenges that she and her wife have faced. And she is very intentional about seeking care. And in the healthcare system where she is, there are very clear signals. Some of the providers have said very explicitly
Mhm.
gender affirming care or, ally. And so what are your thoughts about that in terms of what we can do maybe on our websites or on in our offices and to really, as advocates and for healthcare professionals, to signal to members of this community that we really are a safe space, or at least striving to be.
That is a fabulous question. And it's super simple. Include your pronouns, right? You and I both, I didn't check at the list, but a number of people, we both have she, her on our Zoom, and you can very easily add that whenever you need to. My emails always have she, her. I need to update it. I just got a new system and I usually have a little live link that says, in parentheses, why pronouns matter. And it goes to a website that gives people information about why pronouns are so important. On my door, on any of my flyers, on my website, I am very diligent about making sure that I have it listed that I am LGBTQ friendly. And it doesn't have to be a huge thing. You can just have on there that you are. Um, Including signage that includes individuals of the population in your images. Just like we want to make sure that we have diversity of race, we can have diversity of couples being shown. Doesn't mean it's going to be pornographic. It can be two men holding hands, right? It oftentimes people are like, "Oh, well, what would I be showing?" People. Like it,
Yeah.
why do you
Humans.
got to make it gross? It's fine. Um, but you opening that door, I always typically have my BCPA pin on when I'm doing any kind of advocacy work. I have a little pin that I bought off of Amazon that says my pronouns are she, her, so I always wear that. I have a really cool rainbow pin that I was given as a gift. So I wear those very proudly anytime I'm out doing advocacy work so people can see without that conversation that I'm an ally. And so that's going to really help open the door and just kind of lay that foundation of I am someone that you can go to. If you're really dedicated to doing this work, and I really hope you are, I want to encourage people to go to outcare.org. And Outcare is an organization, especially if you are a provider, or I encourage you to please go to speak with the providers that you're working with that are LGBTQI friendly and get them listed with Outcare. And it's a registry of medical providers, mental health practitioners, anybody that is dedicated to working with LGBTQIA populations nationwide. So
Wow.
I'm listed there as a support. But if you're doing this work and you want other people in your area to be able to find you, this is a great way to do it. They are taking, I've had conversations with them about like, so how are you protecting your data given that this is a public website? And that's something that I really want to make sure that everyone is mindful of, that this is a special time of of the world right now. And so I would understand why people might not want to be listed in a registry like this, but um I'm standing firm in the work that I do, and if I'm on a list that says I'm an LGBTQA positive, then yeah, I'm okay with that. That's important for me to not stand down on
Yeah,
doing that work. But it can be
absolutely.
little things.
Yeah, and we're thankful for you for that. And thank you for sharing. Like you said, just something as simple as pronouns.
Mhm.
It doesn't have to necessarily be a big display, but I appreciate all of the examples and all of the options that you provided. Before I move on to the next question, I want to acknowledge one of the other comments because this is also something I've never heard of. So
Mhm.
someone commented about trans broken arm syndrome,
Yes.
where basically this idea of talking about things that are irrelevant. And so in this example, the extreme, someone comes in with a broken arm and the doctor blames it on hormones.
Yeah.
Wow. So
Yeah.
thank you for lifting that up in the chat. This is my
Absolutely.
mind is being expanded as we speak.
And
So
that
let's talk.
happens a lot, where
Wow.
everything is blamed on your hormones. Well, if you're taking hormones, well, oh well, it's got to be that. And it's like, no. I mean, it's not the same, but to possibly help people understand, women especially anytime we say that we are experiencing any kind of discomfort in our lower regions, oh, well, it's just cramps.
Yeah.
No, it's not just cramps. I know something's wrong with my body. Oh, no, it's just this. It's the same thing. You're being completely ignored as to what might be going on because of one identifying marker, and that's all they can possibly see.
That's called medical gaslighting, by the way.
Yes, it
Absolutely.
is.
So, Melinda, you did a great job helping those of us who are advocates, those of us who may be healthcare professionals, begin to understand the things that we can do to support this community and to mitigate harm. What about the general public? What about members of the community, their family members, their support people, those that may be going to these unsafe medical spaces with the members of the LGBTQIA plus community? What can they do to help advocate for them in those settings and to help, mitigate some of this harm that we've been talking about?
Yeah, absolutely. One, know your rights, right? Patients have the right to be respected. You have the right to ask for another opinion. You have the right to ask for people to use the names that you are giving them, and to receive non-discriminatory care. So, regardless of who you are, regardless of your background, if you're not being treated properly, you have the right to be treated properly and to push back. If you don't feel comfortable pushing back, well, that's what we're here for. And as advocates, let us help you with that. Let us help you talk through what rights you have, get you the resources that you need. My goal is to help people find their own voices so they feel comfortable advocating for themselves. And in the meantime, then I stand and walk with you. I will never speak for someone of the population, but I will speak with. So I can be present with you. Any patient advocate can be present in a conversation with you and then help you get that confidence. Um, we and family members, the biggest thing is believe, listen and believe. When people are telling you that things are happening, don't question, don't say, well, what did you do? Unfortunately, my mom was always, that was always her starter point. I would explain something was going on. She goes, well, what did you do first? What did you say to cause this? I'm like, no, I didn't cause this. I was mistreated.
Wow.
And so for us as family members, as advocates, the biggest thing that we can do is listen and believe and support. And remember that we don't have to understand everything. It might doesn't have to make sense to us to help people get the care that they need. We can just support them because it's another human being who needs support. We can help with documentation. I help a lot of people create a brief health summary that's got their pronouns, there's got their written history. I do this a lot of times with my neurodivergent patients that if they have certain things that will be triggering to them and may cause them to go nonverbal, here's the protocol. If these are the things that might cause me to go nonverbal, here's what to do if I do go nonverbal. And we have a one-page front and back that we've created that they can give to a provider that gives them all the basic information that they're not having to go over every single time. That gives them the information that they need. So that's a little bit more of like advocating for my neurodiverse folks, but a lot of my LGBTQIA folks are also neurodiverse. So we have their pronouns, we have their sexual orientation, we draw attention to it if it's needed, and it's got those things kind of defined out. And when possible, we provide that to any new provider ahead of time so that we're not wasting those precious 5 minutes face to face that we have. We can give any of that information ahead of time. So prepare documentation if you can. And, make sure that you're reporting and documenting harm. Don't, when we hear about this, don't let it go by the wayside. Again, listen and believe and support and get them the resource, get our family members and our loved ones the support that they need. Sometimes it's just knowing that that was a crappy situation and that I've got support is going to help me offer enough. But then other times, no, we need to get involved. And that's when, the mama bear in me comes out. It's like, no, no, you mess with my patient, you mess with my kid. No, we're not letting we're not letting that just go by. Let's get that fixed. And let's find you a different provider that's not going to treat you like that.
Absolutely. Yeah. And I just want to highlight this, getting another provider. I mean, there's so many situations where healthcare providers need to be fired.
Yeah.
And I know I talk to a lot of people who are rightfully concerned, maybe they don't have that many providers in that particular specialty in their area, or maybe they have been with that particular provider for a long time. And, there's just angst. It's almost like staying in an abusive romantic relationship. Like, it's not good for you, but it's what you know.
Right.
And so a lot of people don't even understand, like, you don't have to be abused by your physician, by your healthcare provider. If you're not being taken care of, if you're not being respected,
Right.
by all means, find someone else. And I love how what you shared about the family members and the friends and supporters sometimes being that one to speak up. Because sometimes if you're the victim of discrimination or abuse, or, it may feel, one, you may just be tired of fighting. And two, you may be uncomfortable in that position. And three, you may have even gotten so used to it that you're not recognizing that it's happening in that moment. So
Yeah.
to have that friend or family member who can also be an advocate or even a professional advocate in the room to be able to speak up on your behalf, that just goes such a long way.
Yeah. And
I want
it's sad that we shouldn't have to educate providers, right? But it's our body. We have to protect our peace,
Mhm.
right? It sucks that we have to continue to have it blows my neurodivergent mind that we continue to have conversations about pronouns. It's not that difficult. If I say this is my pronoun, use it. And if you really want the quick and easy thing, just use the person's first name. They said
Yes.
their name is Nicole. Great. I'm just going to keep calling you Nicole. I can't go wrong with that. So when in doubt, use the name that was given to you. But it's our health. It's our well-being, and we have to be able to advocate for it. But you have brought up a good point that sometimes we're so used to it, which is just horrible that we're
It
so
is
used
hard.
to it that we don't even see it, but it's incredibly true. But also we're exhausted.
Yeah.
So being able to support, being able to help out in that way is going to be huge.
I want to talk about allyship, and I want to remind you all, if you have questions, comments, please
Yes.
continue to put them in the chat. We will stop in the middle and address a question.
Hmm.
So please feel free to do that. Um, this idea, I want to talk about allyship because I feel like, particularly since 2020, in some ways that term just kind of became, I don't know, the hot thing to say. And I think that many times we don't fully appreciate what it means to be
Hmm.
an ally. And, there's like true allyship versus performative allyship. And unfortunately, I feel like what we see a lot of now, particularly in this current environment where people scaled back, like, oh, wait, I know I said this a few years ago, but I don't really mean that. So can you talk to us about, what real meaningful allyship looks like?
Yeah. And bringing up this time of year is a great example of this because I want people to kind of be mindful of which companies are still rainbowing everything right now and which ones have just kept their logos and their packaging as normal. Because the ones that are still standing up and using the rainbow and are out and proud and we are letting our freak flags fly, as the saying goes, those are the true allies, right? Allyship is ongoing action, not a moment, right? It's not just saying that you're, a proud, that you love your gay friends, that you love your trans friends in June, but this is year round. It's stepping up when you hear people making jokes that are inappropriate and speaking up for that individual, even if that individual is not in the room. So it's being consistent and committed to, protecting those people's rights. It's giving the education so that they're not constantly having to explain what transitioning is, what dead names are. I tell everybody if you ever have a question about anything LGBTQIA that you're not sure who to ask me. I will take on that emotional labor. I will answer every possible question. I will give transgender 101 lessons until I'm blue in the face because I want to protect my trans friends from having to give that information. Like I am cisgender. I am not trans in any way, but I love a lot of really amazing trans people. And so if I can take that labor from them as an ally, that's what I'm going to do. If I need to protect bathrooms to make sure that they can go to the bathroom and be safe, I'm going to do that. As part of a roller derby team, and we all had shirts made when a lot of that was happening. That was like, if you need someone to go to the bathroom with, we'll hip check for you, meaning we'll beat the person into the wall if we need to.
Oh
And
my.
we had some really fun shirts made that said that we would, protect the bathrooms of our trans friends if they needed. And I still will. I still have friends that are like, I don't feel comfortable. Like, I don't know if I can go to the bathroom. Like, I'll go with you. I'll stand in front of the door. And I've had 6 foot, you know, 5 men, burly guys. I'm like, yeah, my friend's in the bathroom. You can wait a second.
I love
And
that.
like, well, I have to go to the bathroom. I'm like, I know. You can wait a second. They won't be long. And I'm 5'7". Like, I'm not intimidating, but I can be intimidating because I'm just like, if you really got to go, you can go to that one. Um, but we want to also, a lot of it's providing a voice. And again, I don't speak for, I speak with. And this is, I think, something that we can be, especially people that have platforms. I use, I have a lot of privilege in the work that I do with the background that I've had. So I'm trying to be very mindful of the privilege that I check and the ways that I use it. And so when there are people in the community and I can pass the mic to them and let them speak their truths and speak their experiences, even though I'm the first to be asked, I'm going to make sure that I'm giving that opportunity. In fact, even for this talk, I have an individual who works with our team whose partner is trans and they are non-binary. And I really wanted them to join me for this talk and have their voices shared. Unfortunately, their work would not let them take off the time to do it. So they're like, no, 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 you go do it. I'm like, but I want your voice. Like, I want to let you have this platform. But we give them, there's lots of other opportunities that they are doing education and training. And when they joined the team, that was the biggest shift was, okay, anytime I have these talks, if you're available, I would really love to amplify your voice and your experiences and the experiences that you've had with your partner and just ways that I can show up and support, speak with, interrupt harm when I'm seeing it happen. Again, even if those individuals aren't in the room, I'm gonna interrupt that harm. I'm gonna do my best to be like, nah, that's not funny. That's not okay. Those aren't words that we're gonna say. Um, the other big one that individuals always say around me that I have to interrupt is, oh, well, I don't see color. I'm like, well, I'm sorry for you because we should, not just all of the rainbow flags, but everybody's identities that makes them who they are. That's beautiful. And those experiences are so essential. And if you're going to say that you don't see that, man, you live in a really bland world. Like
Mhm.
that's a saltine cracker world that I want no part of. I mean, don't get me wrong, I love me some saltine crackers, but that's it's we want to value everybody's experiences because it makes the world better. So what just finding what we can do. And if you're not sure what you can do, read, watch things that are created or include voices of diverse populations. There are some amazing movies out there, some amazing books out there um, that give that viewpoint. So if you're not sure of anybody who's of this population, but you want to hear more, there are some really great things out there that you can engage with to hear and see from that perspective to help.
Thank you, Melinda. There's always a balance, right? Like there's a balance between wanting to center the voices, but then that fatigue, and like you said, and then the allyship part of kind of speaking. I love you said speak with, not for. because none of us can really speak for a community that we don't belong to, but this idea of speaking with and finding that balance between educating yourself, but also, when you have the opportunity, if it's appropriate, and if it's in a safe environment, you can ask questions and things of that nature, but you never want to burden the
Right.
marginalized community with the responsibility of, educating everyone about their everyday experiences. So I appreciate you sharing that. Well, we're nearing the end. There's definitely been some really important and interesting comments. Thank you all who have contributed to the chat. I want to open it up to see what questions you all have. I know that at least one person today has a question for Melinda. We have learned so much, and this is a safe space, as we've already acknowledged. So please know that your question will be, respected. There's no such thing as a dumb question. We've all been hearing that since we were in grade school, and it really is true. So if there's anyone here who wants to ask a question, feel free to either put it in the chat or you can come off of mute and verbalize your question to Melinda, but I want to make sure I give you all an opportunity to do that before we close.
Mhm. Yeah,
Yes.
Maggie.
Hi. I work primarily with the LGBTQ community as well as the autism community. Seems to be my
Awesome.
niche. And one of the things that I've found a little tricky is family dynamics.
Yeah.
A lot of my clients are not really out to their parents.
Hmm.
So I feel really bad dead naming them in a clinical setting when their parents are present.
Hmm.
But I just don't really know where to draw the line between kind of respecting not outing them.
Hmm.
And sometimes their parents know, but they just get really testy
Yeah.
and really like judgy when
Yeah.
I call them by their actual name.
Right.
So I was wondering if you had any suggestions on how to navigate that as an advocate to support the client and kind of, I don't know, being true to their identity, but also not stepping on toes with very conservative parents.
Yes. First of all, thank you for the work that you're doing. So that's
Yeah, I
amazing.
love it.
And yeah, it's the best. I really, really love it. And I see the same thing. There's a lot of the difficult conversations that we end up having is between families and the patients. So the question that you're asking is really, really, really key. The ways that I've approached it in some cases has I have a conversation with the patient first of, do you want me to correct? What name do you want me to use? I know some patients have not come out to their family members. So if I'm advocating for them or with them, I ask them, what name do you want me to use? And we use that name. The second question is if we are using, we'll go with, our hypothetical Nicole in a beautiful pink dress. Um, if Nicole's family is there and they use the dead name, do you want me to correct them? Or do you want me, or is that going to cause more
Yeah.
harm? So if you're just going to like roll your eyes and take a deep breath and just take that in because every time that they use it, but that's better than the harm that could be caused later on. I want to protect you first and foremost. So what would, and we have this conversation one-on-one about how they want that to occur. If they need Mama Bear to come out and I put family and to what level do they want me to get involved? If it becomes, that it's a disruption and I need to physically remove them, I will gently, again, not physically harming anybody, be like, you know what, Mom and Dad, why don't we come over here and we let, Nicole have this conversation? We're good. Like, do you need me? No, let me distract them so that you can ask the questions that you need to ask. Cool, I got you. Let me get them the heck out of here. So kind of finding out, as an advocate, it's never us telling a patient what to do. It's always like, here are your menu of options. What would you like us to do? And so I do the same thing with that. How can I advocate for you? How much education do I need to give mom and dad or whatever family member it is? What are the triggers for you that I need to be mindful of? And when I hear it or see it, what kind of action would you like me to take? And so that has typically worked. And I will be happy to say there's only been once or twice where my intervening in a situation didn't kind of stop it immediately. It may have continued on later on, but they didn't keep pushing in that thing or in that moment. Typically, once I'm like, hey, so, we're really going to make sure that we're respecting Nicole and we're going to use Nicole's name. And typically that shut down because now they're getting kind of reprehended by by the other individual. Have you tried anything like that?
Yeah, no, I
Oh,
always discuss with the client
oh.
who address, like, when to address them by their
Mhm.
dead name, which generally I don't like to. I just say the patient and
Yeah,
they, just to kind of avoid doing that.
it's a great
But
idea.
I really like the idea of distraction. That's the one thing I have not tried, is that I can think of one client in particular where I feel like that would be very beneficial.
Yeah, yeah, good.
Thank you.
Yeah, if there's additional stuff that I come up with, feel free to reach out. I'm happy to help.
Thank you so much, Maggie. There's one more question in the chat. I know we're not going to have time to answer it fully, Melinda, but maybe you can give a short
I'll
answer.
try.
Maybe you can, if that person can contact you after. But any tips for supporting their teen in high school, being a handsome trans man, and how to support him changing his name? I just love
Tell
that.
them how handsome they are, encourage them and then support them to be in their identity and love them as they are. That's gonna have a huge impact. There are gonna be times when they're not feeling that supports, but always knowing that you and whoever you can rally to be their cheerleaders, just encourage them and remind them every single day that they are amazing as they are and courageous for who they are, and I think that's like the biggest first step. And then just giving any support, asking questions. What do you need? How can I help? Where do you need me to do more? Where do you need me to back off? Teenagers are funny little creatures. That's why I have dogs and not humans. But I work with a lot of teens at the Pride Center, and just giving that support and honoring that identity, and again listening and believing, having the courage to have that conversation even if you're like, I might mess this up, I'm going to say the wrong thing. That's okay. If it's coming from a place of love and you say, hey, this might be a difficult conversation, but this is coming from love, here's what goal I have, and say, I want you to know that I love you and support you, and I don't know how to navigate this, so we're going to do this together. And we go from there. And I obviously please everyone on this call, anybody who's watching this later, you know, this is why I do the work that I do. And a lot of my background is in communication. I have 25 years of as a communication professor, and helping people have those conversations. How do I ask this question? How do I navigate? If they say this, what do I do? If this escalates, how do I de-escalate it? That's that's what I do. And I would love to be a support, and for the caregivers, if you're an allies going, I don't know what to do, reach out. Please don't hesitate. Let me help.
Awesome. Well, thank you, Melinda. Thank you to all of you for being here. Can we give Melinda some hearts? Let me find my heart reaction.
I love you all. Thank you.
Melinda, some hearts for just an amazing conversation. Thank you for expanding our knowledge and our hearts. And you all can also don't forget that Health Advocate X has an X Center for Transgender Care. So feel
Where I
free to
get to
go.
share lots of voices. It's not just me.
Yes, so please check that out for additional resources. And we look forward to seeing you all for our next community conversations. Thank you so much.
Thank
Thank you
you.
all.
Thank you.